Hi, my name is Dr. Michelle Chang. Welcome to our bariatric program. We're so excited to work with you on helping you become healthier on your journey. We're going to go through a few key topics to prepare you for bariatric surgery so that all along the way you're well informed and you know what to expect before your first post-operative visit. In your preoperative visit, we'll provide you with a bariatric handbook so that you have a clear idea of the diet advancements and things you should know after surgery. One of the key pages that I want you to pay attention to would be the two-week preoperative liquid diet. The 2-week preoperative liquid diet consists of a fully liquid diet where your nutrition mainly comes from protein shakes. So at least 3 times a day, you should be drinking protein shakes and staying hydrated by drinking at least 64 ounces of water. Other than the shakes and the water, you can also have cottage cheese, Greek yogurt, broth, sugar-free Jell-O, sugar-free sport drinks. And this preoperative liquid diet is very helpful when it comes to surgery because it helps to decrease the size of your liver, which also helps with decreasing any intraoperative bleeding from the liver. On the day of surgery, we'll have you present to St. Mary's Hospital 2 hours before your scheduled operating time. In the preoperative area, the nurses will get you ready for bariatric surgery by having you do a cleaning wipe down to clean your skin. We'll also have you take some preoperative medication to decrease post-op pain and nausea. The anesthesia providers will introduce themselves to you and get consent. And then shortly afterwards, we'll proceed with the surgery. After the surgery, you'll be in the recovery area and eventually move to the bariatric floor on the 4th floor. A typical hospital stay is 1 night in the hospital. And during that hospital stay, what we're looking for is to make sure that you're able to tolerate liquids without having nausea, that your vitals and your labs are reassuring after surgery. And so for most patients, they're able to go home the next morning. I want to just remind you that it's important to reference back to the Bariatric Handbook as far as your post-operative diet, which explains very clearly that for most patients, you'll be on a 2-week liquid diet again after surgery. We will also provide you with discharge instructions when you're ready to go home. It's also very important that you arrange for a key family member or close friend to be the person who picks you up from the hospital and helps you out at home. Bariatric surgery does create changes, and you may have changes in your energy or appetite. So it's good to have a key point person to help support you along the way. After you leave the hospital, while you're on the liquid diet, it's important to monitor for any signs of dehydration. If your urine's looking dark or you're feeling dizzy or lightheaded, that's a sign that your body is telling you that you need to hydrate better. In general, I recommend that you take small sips of water or electrolyte drink every 20 minutes to make sure you're staying hydrated. Furthermore, it's also important to make sure that you go on frequent small walks throughout the day so that you don't develop any blood clots in your legs. After you go home, you can shower the next day and use soap and water to rinse over your incisions. You will have purple skin glue that will eventually flake off in the shower after a week or so. Try to avoid being in a bathtub or pool for about 2 weeks to decrease the risk of surgical site infection. For activity, we encourage you to walk frequently, but don't lift or push anything heavy, such as anything greater than 10 pounds for 2 months. This is to allow your muscles to fully heal so you don't develop any hernia. While the surgery for the most part is safe, there are some risks to be aware of, and we want to know if you're having any problems at home. So some signs and symptoms to look out for would be severe or sharp abdominal pain, persistent nausea, vomiting that's not controlled with medication, if you're having shortness of breath, fever with a temperature greater than 101, or severe constipation that's not controlled with bowel regimen medication. If you're having any of these problems, please call our office because we have a 24/7 on-call person who can help you. A lot of people ask about what the pain is like after surgery, and here are some tips that I recommend following so that you have less issues with pain after surgery. So number 1, use different forms of pain medications. Other than the prescribed pain medication, use Tylenol as needed and apply ice packs to the abdomen. You can also wear the abdominal binder that we provide in the hospital to help make you feel comfortable and supported. Walking is also encouraged because as you're passing gas and moving your bowels more, you will feel less bloated and more comfortable. So these are some of my tips to make you more comfortable during your hospital stay and after surgery. We want to make sure that you're doing well. It's important to know that with these permanent changes to your stomach or GI tract, and as you're losing weight, you may develop vitamin deficiencies. So to counter that, it's important for you to purchase bariatric multivitamins before surgery. And there's a page in our handbook that kind of goes over different forms of bariatric multivitamins that you should look into. If you have any questions or concerns about purchasing bariatric multivitamins, let's talk about that before surgery. Thank you for taking the time to watch this video. Our hope is that you find this video useful as you're preparing for bariatric surgery. I would expect that you review this video a couple times before your preoperative visit so that when you come for your visit, feel free to ask us any questions that you have lingering. This video highlights multiple things that are included in our bariatric handbook. And so please review the handbook as well because it has a lot of details on the preoperative diet, postoperative diet, and things to expect. Again, thank you so much for working with us, and we're so happy to help you along your way.